So hi everyone, welcome back to the session today, and in this session we are going to demonstrate on how to do the cleaning and shaping of this grossly carious mandibular molar, for which we had initially started with the excess cavity preparation followed by the working length determination with the help of electronic apex locator. In this session we are going to cover up on how to do the cleaning and shaping of these canals that we have already negotiated. This is the distal canal, the single large distal canal. As you can see, the probe is freely moving and even the file was freely getting engaged. Then this is the mesolingual and the mesobuccal and the mesolingual canal. In this session we are going to demonstrate on the Rotoflex blue file system, the Rotoflex blue. So how to prepare the canals? We have already determined the working length. So initial file that we are going to use is 30 by 08, that is for the initial orifice enlargement. We can use the orifice enlargers like the GZ drills also, but we have in this system the orifice enlargers, so we can use that also. So it is a 30 by 08. Just enlarging the coronal segment. As you can see, the debris that are coming out, I am not going, just going against the walls. That is enough. Clean the fluids of the file, or you may prefer to use the irrigant. So over here we are using the saline as an irrigant. Never prepare the canals dry. You can use the irrigant as a lubricant inside the canal orifices. This is a side wind needle. So now enlarging the mesial canal orifices. This is the mesobuccal canal orifice. See the debris that have come out. So again flush out the debris with the help of saline. The second or the last canal that needs to get enlarged is this one, the mesolingual. The orifices, we are just enlarging the orifices with the orifices opener, that is 30 by 08. And done. Flush with saline. Over here I would like to ask you the initial irrigant that should be preferred, or what you prefer during the endodontic treatment. What could be the first irrigant that should be used? So now you can appreciate that the orifices have been enlarged. And this is the time we are going to now insert the files as per the working length that we had determined. So we are going to use the 10K file initially and up to the working length. In all the canals. There would be a minimal resistance. You should be working against the walls. And now is the time to irrigate with sodium hypochlorite. You are entering inside the canals. So the irrigant that we are using is the sodium hypochlorite. The second sequence of file should be the 15K file. Once you have used the 15K file, again the irrigant can be sodium hypochlorite. What could be the first irrigant that you prefer during the endodontic treatment? Preferably the cleaning and shaping. See the debris that are being flushed out. Now you can clearly see how good the orifices are looking and how good the visualization is there. The next sequence of file that we can use in the Rotoflex file system is (15/04). So this is 15/04, and this would establish the glide path. So this canal is larger, so we would straight away use the file designated for the larger sequence. This is the medium sized canal. So once you have irrigated it, now you may use the saline as an irrigant. Once the saline has been used, this is the time you may negotiate the canals, or you may do the recapitulation with a 10K file. Once the recapitulation is done, this is the time you may introduce the next irrigant. The preferred irrigant is the chlorhexidine. So once you have used the chlorhexidine, just let it remain for few minutes, then you may just flush it out with the saline. So the next file that you may be using is, since the files are, or the canals are little larger, so you may be using 20 by 06. This is corresponding to the F1 file. So this is 20 by 06 from Rotoflex. Remember to keep the irrigant inside the canal. This would act as a lubricant. Once done, now the irrigant that is suitable is the sodium hypochlorite again. Over here we are using the side vent needle. So once done, we have prepared the canals, and we should be able to again recapitulate and check for the canal patency. And now, since the distal canal is little bit larger, so we would be using the 2506 for the distal canal. So here it is, the 2506 for the distal canal. So we have done with the sodium hypochlorite, and now is the time to finally irrigate with the saline as a final irrigant. So finally check for the canal patency once all the files have been, or the rotary endodontics have been done. Now flush out any debris since you used the file. So this is how your canal should be cleaned and shaped. This is the large distal canal orifice that you can visually see. These are the small mesobuccal canal orifice and the mesolingual canal orifice. So we have done the cleaning and shaping, and the next step is the obturation of these canals. So hope you were able to understand the step-by-step procedure of cleaning and shaping with the help of Rotoflex file system, Rotoflex Blue from Preface 10 Pro. If you have any queries, you can ask in the comment section below this video. And we would be back with the obturation of these canals followed by the post-operative restoration. Thanks for watching. Bye bye.